Okay, so good morning, everyone. Dr. Eisen and I are very excited to present this webinar this morning. It's going to be about 30 minutes long, followed by a question and answer. I'm Dr. Delia Garcia, and again, my partner in crime is Dr. Brenda Eisen. Our topic this morning is health coaching for health professionals. You might be on this webinar because you are a health professional. You might be on this webinar because you're a health coach working with health professionals. So welcome. And the wonderful thing about health coaching, if you're a health professional, is it does allow you the possibility to create an income stream that can help you provide more balance in your life and give you more time for the things that really matter. For instance, a friend of ours, Joe from Florida, you can see him there in his surgical scrubs, now has the time, because of his health coaching income, now has the time to spend more time doing missionary work in Africa. And he goes there every single year with a group of other physicians. Dr. Eisen and I have more time to spend with our families, and we have more time really to spend with our patients because our patients are not as sick as they were. We've helped them get healthier. So I'd like to begin with my story of how I ended up getting involved with health coaching. My specialty is that of breast cancer. So I am an oncologist and I practice medicine for almost 30 years. In my breast cancer practice, I kept seeing younger and younger women with breast cancer. And I came to realize that there certainly was a link between overweight and obesity and breast cancer, because what excess weight does is it results in estrogen dominance, high circulating estrogen levels, and that's the precursor for breast cancer. So for at least 20 years, I counseled my patients on diet and lifestyle, but I didn't have a tool to help them get their weight off fast and safely until I was introduced to this particular program. And I love the pictures on the right of Tina. Tina lost her mother to breast cancer when Tina was 12 years old, and Tina became the grocery shopper for her family. Her sister was 9, her brother was 16, and she was 12. So you can imagine what a 12-year-old is buying at the grocery store. From the time Tina was in junior high, she was obese. And Tina tried our program a few years ago, lost 93 pounds. Not only does she look fabulous, but Tina has drastically reduced her risk of breast cancer, which was already higher than the normal population because her mother had breast cancer. And so that is what we're able to provide to our patients and to the people that we encounter in our daily lives with the program that I will share with you. Brenda, would you like to share your story of how you got started?
Yes, I am a family physician and I practiced primary care medicine for almost 30 years. I'm retired now, happily, and while I was practicing medicine, I really had an emphasis on wellness. I wanted to try to prevent disease rather than react to disease. And one of the problems which I saw was increasing in the general population and in my practice specifically was patients who were overweight, and many of them were very overweight. And in fact, in 2008, I had to buy a new scale for my office because I had so many patients who were over 300 pounds that the traditional balance scale that had been used successfully in physicians' offices for years was no longer adequate to weigh these patients. It would have to be recalibrated after a patient stepped on it who was over 300 pounds. So shortly after I bought this balance scale, I was having a conversation with Dr. Garcia about a mutual patient. And following that conversation, we were catching up on what was new and different in our lives. And she told me about this program and how it was helping her be so much more successful with helping her patients to lose weight and get healthier. And I was very excited and wanted to bring this program into my office right away. And so she came the next day, and I started providing this wonderful program for my patients. And the results were just phenomenal. Patients were losing weight, keeping it off. They were improving their cholesterol scores. They were being able to get off of diabetes medications if they had type 2 diabetes. It was amazing.
Thank you, Brenda. And I'd like to call attention to something that's happening in healthcare today. So we have these acronyms, MACRA MIPS, and what they stand for is a shift from a fee-for-service to a value-based care system. And physicians are now having to demonstrate to Medicare and other insurance providers better patient outcomes in terms of cholesterol, BMI, blood sugars, hemoglobin A1Cs, because at the end of the day, it's all about lowering the cost of healthcare. Our current healthcare system is completely unsustainable. And at the end of the day, it's all about improving population health. So it's now a mandatory system that is being implemented, that physicians and healthcare providers have to show better patient outcomes. So this is a game changer. We know that better patient outcomes can be shown by helping patients get to a healthier weight. And I love this picture of David. David was all set up for bariatric surgery, which is immensely expensive. And David was then introduced to our program. Instead of having the surgery, he tried our program. He went on to lose 200 pounds without the surgery, without any medications. So what our program provides to health professionals is the opportunity to get the patients healthy at no extra cost to the practice. So if patients are getting healthier, they're going to be more satisfied. The CMS outcome scores will improve. Incentive pay from Medicare and the insurance providers will improve. And also it gives health professionals an opportunity to create an income stream from health coaching without having to bill managed care. So it's a win-win for everybody. We know we have a health crisis in our country, and that the root cause of about 80% of everything we see in the doctor's office, in the surgery centers, in the operating room, in the emergency room, about 80% is secondary to obesity. And you can see from this map of the US that obesity rates are as high as 30% or more in some of the states. So we have a lot of work to do, and fortunately we have a wonderful tool that works. So being overweight and obese is not just a cosmetic problem. As Dr. Eisen mentioned from her own practice, the excess weight leads to insulin resistance, which leads to diabetes, which leads to cardiovascular disease. And then from my background as an oncologist, there are so many cancers that are tied to obesity. Breast cancer, prostate cancer, colorectal cancer are the three biggest ones, but also cancer of the pancreas and others as well. So we have such an opportunity to help our patients not only get healthier and lower those cholesterol levels and get off their medications, but to reduce their risk of the major killers. So with our program, it's not just about helping our patients get to a better weight and eventually their optimal weight, but teaching them the lifestyle pieces that go hand in hand so that they don't gain the weight back. We know that optimal health is more than the number on the scale. It has to do with, of course, healthy eating, but also hydration with movement, better sleep, stress reduction, lowering inflammation, so many things that are tied into one. So with our program, we have 4 components. The most important component is the health coaching. Health coaching is very positive. It's about walking alongside that patient and helping them every step of the way, empowering them to learn about the lifestyle pieces. And we have a wonderful lifestyle program that we give to the patients along with the structured meal plan. But then we also have a community of support. We have support calls every week that our patients can tap into. There's no extra charge for that. Brenda and I have an active Facebook support page where patients interact with one another and support one another, whether they're struggling or they're having wonderful results. They reach out and share that with one another. So with our structured meal plan, it couldn't be simpler. From day one, our patients are learning what healthy eating is. And the healthy eating revolves around lean protein and vegetables or a salad. So once a day, they're eating the lean and green meal, either a meal that they prepare at home or that they can eat in a restaurant. The rest of the time, they're tapping into our medically formulated fuelings. These are food products that are protein carbohydrate balanced, they're low glycemic, they're low in fat, they're clean products, there are no artificial flavorings, no artificial ingredients of any kind, no artificial sweeteners. They have probiotics in every serving because we know that probiotics are so important for gut health and overall health. So our patients are eating every 3 hours, something that's super simple and all figured out for them. And then once a day, they eat this delicious lean and green meal. And the wonderful thing is that with this program, the scale moves every week. If they're doing the program as it's spelled out, the scale moves every week. So they feel empowered because they're seeing the positive changes. They have more energy. And we love the transformations. These are some of the results that we're seeing with our program. Lori on the left lost 100 pounds on the program. Our surgeon friend from Florida lost 123 pounds in 8 months. Graciela, who lives in California, it's totally transformed her life as well. So we love the transformations. It's the thing that keeps the patients moving forward because they do see the results and they have more energy. But at the end of the day, it's the coaching and it's the community of support that is so powerful in helping these patients feel loved and supported and guided along. Unlike other programs, most of them being diets where the food may arrive and no one calls them. With our program, the food arrives and we help them get started, and then we touch base with them every week to make sure that they're moving forward. So losing the weight is one step of our program. You can see this stair step. So losing the weight is one phase, but there's so much more to our program, the whole lifestyle piece. And then once they get to their goal weight, the transition and the maintenance piece so that they don't gain their weight back. And we do that with these with this lifestyle support tools, a wonderful book and workbook written by the founder of our program, Dr. Anderson, who was a critical care physician. Brenda, do you want to talk about your wonderful patient, Debbie, and what happened with her family?
Debbie came in to see me. She had been my patient for many, many years, and she developed hypertension. And she was very upset because her mother was chronically ill at the time, and her mother was also obese, and she had hypertension. And Debbie's blood pressure was high enough that she needed to start on some antihypertensive medication. And she was really upset when she realized that the medication that I suggested for her was the same medication that her mother was taking. So she felt like she was just following in her mother's footsteps. And she asked me that day if there was anything that she could do short of taking blood pressure medicine for the rest of her life in order to control her blood pressure. And I told her that if she would lose weight and get to a healthy place, that she could probably come off of the blood pressure medication. And Debbie really threw herself into that challenge, and she lost 85 pounds in 8 months and was able to come off of the blood pressure medication pretty much right away as soon as she changed her eating habits. Debbie was able to influence a lot of people following her transformation, including her son, Joe, who's on the left side of the screen. Joe was in high school at the time, and he lost 40 pounds and began to eat vegetables for the first time in his life. And he was able to go to college as a new individual, slim and trim. And Debbie also influenced other members of her extended family. And for the first time, people who had been overweight their entire lives were getting healthy. And then Debbie's friend Pam noticed her transformation, and she also began the program. Pam was she is a professional photographer, and just getting around and getting through her days was very difficult because of her weight. When she would have a social occasion to go out with friends for lunch, she had to call ahead to the restaurant to see what kind of chairs they had, because if they had chairs with arms or if there were booths, she would politely decline the invitation because she knew that she wouldn't be able to sit in those chairs or get into a booth and get back out. Pam went on to lose 220 pounds and really underwent an amazing transformation, as you can see by her pictures here.
Oh, I love the stories, Brenda. It's just amazing. And you and I together have now helped thousands of people transform their lives. So it's just so wonderful. And this is before and after pictures of Linda, who lost over 90 pounds. Linda has kept it off for more than 5 years now. And with our program, we really have two phases. The first phase is getting to that healthy weight, using our wonderful fuelings, and then transitioning to healthy whole food beyond the fuelings, or continuing to use the fuelings for healthy fast food and snacks. Once our patients get to a healthy weight, it's learning how to keep the weight off. And that's where the lifestyle pieces come on. That's where the continuing to eat lean and green meals is so important. And all of that is supported by those support calls that they can tap into each and every week. We have a 30-minute support call from a physician and a nurse The patients can ask questions if they get on those support calls. And then we have a 30-minute webinar that covers some aspect of lifestyle. And they can continue to tap into those for the rest of their lives, even if they're no longer on the program. And at the end of the day, what this is all about is not only helping our patients reduce or eliminate medications, as Brenda alluded to with her patient who was able to get off hypertensive medication, also reversing diabetes and reducing our patients' risk of the major disease killers, whether that be cancer, diabetes, stroke, Alzheimer's. This is a study from the Cleveland Clinic showing that if you take someone who's obese and you help them get to their optimal weight of a BMI of 24 or less, all of these medical conditions improve in huge percentages. So if we look over here on the left, diabetes, type 2 diabetes, can be reversed about 83% of the time. Sleep apnea up to 80%, up to 98% of patients can get off their sleep apnea machines. Asthma improved 82% of the time. And in the lower right-hand corner, we see that the risk of that the 5-year mortality of dying of any disease can be reduced by 89% by getting to a healthy weight. So wonderful, wonderful results, and the opportunity to really improve that health and well-being of our patients. So adding health coaching to a medical practice is very simple, and it's so rewarding. You're helping others get healthy. There's no inventory. The products are shipping directly from the company. Low startup costs for $200. You can be in business. There's no overhead, no billing. We're not billing insurance companies. The financial transaction is between the patient and the company that provides the fuelings. It doesn't take a lot of extra time to offer this kind of program in a medical practice, and we provide complete training and support. And the wonderful thing is we have the opportunity as health professionals to create more balance in our own lives. Brenda, you want to tell the rest of your story?
Yes, I would love to. As I was practicing my family medicine career, things began to change in medicine, and all of you are probably aware of some of those changes. I had a huge number of patients. At one point in time, I had 6,000 charts and about 4,800 active patients. So I was busy all of the time, and all of my other relationships suffered. My health was suffering. And as my health began to suffer, my financial well-being at work began to suffer as well, because I could no longer see, mid-30s of patients per day and stay up until 4 a.m. working on charting and then go back and start all over again in a couple of hours after that. Things began to get worse at work, and I began to look at things critically and realized that the thing that I enjoyed the most about my practice was the health coaching. It was the positive aspect of things, the fun aspect of it. And I also realized that it was really the piece that was allowing me to continue practicing medicine as the financial part of my medical practice began to decline. So I decided to take my health coaching business and go home. And in May of 2013, I retired from primary care medicine, and it's just been amazing since that time. I've been able to travel with my family, as you can see on the right side of the screen, a picture of all of us together. I never would have been able to do that in the past. I would have been staying at home working while everyone else traveled. So it's totally changed my life being a health coach. And now I wake up in the morning. If the weather's bad, I pick up my laptop and my computer, my laptop and my cell phone, and I can sit on my bed and watch the snow come down and call my patients and work with them remotely. And I have patients now all over the country. So this job can be done remotely with patients who are located anywhere. And it's just been a fabulous experience for me.
Thank you, Brenda. It really is a virtual business with a cell phone and a laptop. Most of our coaching takes place over the phone. Sometimes we use video conferencing, such as what we're experiencing here. So with health coaching, if a health professional decided to do it full time, there are no emergencies. Unlike traditional medicine, you don't have night call. You're not selling, you're simply sharing the opportunity to help those patients create better health. You have no inventory, there's no managed care, no ICD codes. You're not even practicing medicine. There's never been a single lawsuit with this program model. And so I do not maintain malpractice insurance. I, like Brenda, retired from mainstream medicine in 2011. We guide our patients to health, and you truly are the CEO of your business. So let me talk a little bit about how the compensation works. Our patients actually get our coaching for free, and we get paid by the company that provides the fuelings, a percentage of everything that that patient orders. So we get paid 15 to 31%, depending on the volume, how many patients we have on the program. And also the company pays us quarterly bonuses as well. So here's how the dollars look if you are using this program for your patients. If you had 5 active patients, that means patients that are on the weight loss phase of our program, you would be generating $400 a month with just 5 active patients. So that's a little shy of $5,000 a year. If you had 25 active patients, that would be $2,400 a month, which translates into $32,000 a year. And you can see if you had 50 active patients, a little less than $5,000 a month, about $60,000 a year, and so on and so forth. This is based on $300 a month times 31% plus quarterly bonuses of $1,000. So if a practice like Dr. Eisen, who had 500 or 5,000 patients, if you just enrolled 2% of your patient population, you could generate $10,000 a month with this program. So it's real money helping people get what they want, which is better health and reducing their disease risk. So again, as I mentioned, I retired from traditional medicine in 2011. I was in my mid-50s at the time. I owned my own breast cancer center, but one of the hospitals had bought our center, and overnight it drastically changed. So I stayed for 2 years, and then I decided to do health coaching full-time. And I now have this extraordinary life of balance, of being able to spend more time with my family, of being able to travel, to be home more because I work from home, to be able to spend time with my pets. All of the things that matter to us as human beings, but that we oftentimes don't have time for. So where do you go from here? If you liked what you heard this morning, talk to the person that invited you to the webinar. reach out to Dr. Eisen and myself if you have any questions, or you want to learn more, or you're ready to become a health coach. So thank you for being on this morning, and we welcome any questions.